Dr. Benwill, thank you very much for joining us here on Health Connection. Always a pleasure to have you. Our topic, superbugs, join the fight before it's too late. That sounds a little ominous. Let's start with a definition. What does the term superbug mean?
Superbug is just a generic term indicating that specifically bacteria that have acquired many resistant pattern and developed resistance to commonly prescribed antibiotics. There are a few of these superbugs, and so they have to have many they have to be very resistant to antibiotics.
How does that happen? How do they become resistant to antibiotics?
You know, bacteria are very sophisticated. They've been around for thousands and thousands of years. And really the antibiotic era that we are living in now is relatively short compared to their history. And so they have a wide variety of mechanisms. In general, they develop resistance to antibiotics. When someone doesn't take their complete course of antibiotics, there's a subpopulation, 1 or 2 bacteria that are still in the body that were not treated or killed by the bacteria or by the antibiotic, and they can still live in the host in the body and then reappear with a new infection.
Why are we hearing more about this now?
Well, I think it goes back to really the antibiotic era that we're living in, and the development of penicillin and actually its use starting in the 1940s. And we have a very good correlation of people being exposed to antibiotics and then subsequent years developing resistance. That these bacteria develop and outsmart the antibiotics.
Who's at greater risk for contracting or having to deal with a superbug?
For the vast majority, it's those that have tremendous exposure to the healthcare environment. Patients that are sick in the hospital, have had specific invasive procedures, and have chronic medical conditions.
Are some superbug infections more serious than others?
Yes, and it really depends on which side of the body they're infecting. Is it a urinary tract infection? Is it a bloodstream infection? Is it pneumonia? And that also plays a part of how serious the infection and which bacteria. Everyone knows about MRSA and its development.
Let's assume that they don't. What is MRSA? MRSA it's called.
MRSA. It's methicillin-resistant Staph aureus. And it was almost exclusively seen in the hospital setting. And Staph aureus became adaptable and smart, and actually it started developing and appearing in communities and not in the hospital. Another superbug is Clostridium difficile infection, known to cause diarrhea, usually associated with prior antibiotic use. Almost exclusively seen in hospital or healthcare facilities. And now it's more recognized that actually patients can develop these infections in a community with very little healthcare exposure.
So we've mentioned antibiotics. When is it appropriate to take antibiotics and when is it not?
It's almost, it's pretty straightforward in the sense antibiotics target bacteria, and they are not effective against viruses. And so people should not pressure their physicians if they have made a clinical decision. This is most likely viral. I don't think you're going to benefit from antibiotics. Don't take them.
To what degree has patient pressure caused doctors to prescribe antibiotics that has ultimately contributed to this problem?
It has become a huge problem, and it has been part of the healthcare environment and trying to re-educate patients about the importance of viruses and bacteria and the judicious use of antibiotics. because we have become or have developed kind of a vicious cycle of you go to the doctor, you get antibiotics, and many times they have looked at this, particularly in pediatric offices, that the use of antibiotics has not been appropriate, and trying to minimize that inappropriate use of antibiotics to minimize the risk of acquiring one of these superbugs.
Staying on the subject of antibiotics, why is developing an antibiotic so difficult, and are there any new ones in the pipeline?
There are new antibiotics in the pipeline. Really, when we look about other drugs and development and going through the standardized process through the FDA and doing bench research, trying to develop a compound that has antibacterial properties, moving into animal studies, seeing how it's effective in targeting specific parts of the body and different infections or bacteria. It takes a tremendous amount of money and research. With the recognition of these superbugs, it's really become a global and a national effort in the United States to develop coalitions to spend money developing these antibiotics. In comparison to chemotherapy drugs, what's in the news a lot about these new hepatitis C drugs, the cost of antibiotics in the hospital or even outpatient cannot even compare to the cost of chemotherapy or these new hepatitis C drugs. Those drugs are on the magnitude of 1,000, 10,000 times the cost of antibiotics in the hospital or that you get filled at your pharmacy.
And thus, there's less incentive for the manufacturers to spend time and money on them.
That's correct.
Okay, makes sense. What is advanced molecular detection, and does it have potential in the fight against superbugs?
It's very interesting. The microbiology, the study and growing bacteria has really stayed the same for many years. You collect a patient sample, a blood culture, you incubate it, you wait to see if anything grows. And then once it grows, then you're able to do antibiotic testing against it, susceptibility testing, to see which antibiotics will work against that particular bacteria. It's laborious, sometimes takes weeks, days to weeks to get these results. What we're now in the era of molecular genetics and doing whole genomic sequencing on bacteria. What we know about bacteria is that the vast majority we're not able to culture. And so these molecular techniques are there to identify bacteria that we weren't able to identify before. And basically it's using the DNA, protein, the structure of bacteria and viruses for accurate detection and not waiting until you can actually grow the bacteria in the microbiology lab.
Uh-huh.
This has really changed the landscape specifically for TB and doing basic antibiotic testing in the field for multi-drug resistant TB or extensively drug resistant TB and other bacteria. So we have a faster answer, potentially 1 to 2 days compared to weeks.
Uh-huh. So the best bacterial infection is the one that you never get. What can we do as common sense and otherwise to avoid bacterial infections in the first place?
It's very simple. Hand washing cannot be overemphasized. Proper hand washing, and if you are going to a healthcare facility, seeing someone in the hospital, wash your hands. Encourage healthcare workers to wash their hands because it really is in those environments that you can be exposed and can acquire one of these infections. Another very important preventative step would be vaccines. We hear a lot about the flu vaccine. That has been shown to minimize hospitalization complications. So if you can prevent being hospitalized with a serious infection, that can be preventable with a vaccine. That has tremendous value.
Very well, Doctor. Thank you very much for your time.
Thank you.